crazy.
It's Thursday. Dr. Scott back in the house. Scott, you help the wellness director at the Phil Long dealerships. And Scott, the last couple of weeks we've been talking about the food side of getting into shape. What about the physical side? How do we go about starting the program?
Well, the first thing you always want to make sure you do is check with your doctor, especially if you haven't been active or you're getting a little older in age, and I'll let you fill in what that age is. But after that, there's really 5 components of fitness that you want to hone in on, and those are the health-related components, which are basically flexibility, body composition, muscular strength, muscular endurance, and then finally cardiovascular fitness.
Let's start with flexibility. What do you mean by that? Like just stretching all the time, or?
That's a start. You know, actually, flexibility or yoga, if you will, is stretching on steroids, and it's a lot of fun. If you've never stretched or never done yoga, you should give it a shot, especially if you've never really been a fitness buff. It's a good place to start. But flexibility, it's very joint specific, so you've got to stretch your hamstring as well as your leg or your back or anything like that. But it's the most easily lost, yet it's the most easily retained of the health-related components of fitness.
Let's talk about body composition. What does that mean? Body
composition. Commonly you hear about the body mass index, and if you know someone's height and their weight, you can figure a body mass index. It's just a mathematical equation. But it really doesn't tell you what that mass or that weight is. And what you can get is if you have a skin fold caliper, which I think is a more effective way to measure someone's body composition, you can actually tell what % of them is body fat versus lean body mass.
You've got a caliper over there, right?
Yes, I do.
How does this work?
Obviously, you would want to get on the skin, but in a nutshell, you can actually pinch various parts of your body, and you can feel deeper, denser tissue, and that's the muscle mass of your body, and you can separate out skin and body fat. And then you put that caliper on there and you measure the thickness of the skin fold.
Is that what these numbers mean?
That's correct, and it's in millimeters, and you measure 3, 4, 5, 6 sites, and then you can actually go to a regression equation and find out what % someone's body fat is, and then
based upon the measurement, the number of millimeters.
Correct.
Is there a good range?
There is a good range. If you're a male and you're less than 25% body fat, that's good. If you're a female and you're less than 30, that's good.
Real quickly, the other 3 elements you say are all cardiovascular, muscular endurance, and muscular strength. Touch on those real quick. We've got about 30 seconds left.
Well, muscular endurance and muscular strength, that's basically revolves around your muscles. And you can do things like garden and not necessarily always have to go to a gym. The last one, cardiovascular fitness, that's what you always hear about, aerobics, so to speak. And that could be walking, any of that stuff.
You say, if you're going to be with us next week, if you got one of these, what is this?
That's gym in a bag right there. If you buy one of those, you can be as fit as you want, wherever you want.
It's like a tension band with holders, right?
Yeah, a little TheraBand.
Great, because next week you say we can have a home gym, basically. We can get fit.
That is a home gym.
All right, so if you want to play along with this next week, go out and grab one of these, and we'll take it, and we'll test it.
No doubt about it.
We'll test it in the doorway somewhere. Dr. Scott, thanks for coming in.
Thanks.
See you next week with one of these.
Yeah.